Double outlet right ventricle had been divided into 4 clinical types earlier. TOF-like features resemble tetralogy of Fallot with VSD and pulmonary stenosis. ECG shows right axis deviation. TGA-like subpulmonary VSD with or without PS. ECG shows left ventricular volume overload with right axis deviation. VSD-like subaortic VSD without PS. ECG shows LV volume overload and left axis deviation. Eisenmenger-like subaortic VSD with pulmonary vascular obstructive disease. Society of Thoracic Surgeons and European Association of Cardiothoracic Surgery international nomenclature defines 4 types of DORV based on the clinical presentation and treatment. VSD type, Fallot type, TGA type, that is Taussig Bing, and DORV non-committed VSD, that is remote VSD. VSD type presents with clinical signs of unrestricted ventricular septal defect. In VSD type, the VSD is subaortic. Fallot type has either a subaortic or doubly committed VSD and pulmonary outflow stenosis. TGA type presents in newborn period like transposition of great arteries. It has a subpulmonary VSD and the pulmonary artery does not arise 100% from the right ventricle. In DORV non-committed VSD or remote VSD type, the VSD is not related to either great vessel and can extend from perimembranous region to the inlet or trabecular region. The VSD is separated by muscle of size more than the aortic diameter from the great vessels. Double conus is constantly present in this type and both great vessels arrives fully from the right ventricle. 8 echocardiographic types have been described by Pang and Associates. The classification was based on 3 factors: the relative position of great arteries, whether it was normal or abnormal, the relationship between great arteries and the VSD, whether committed or non-committed, and the presence or absence of right ventricular outflow tract obstruction. They named types 1, 2, 3 and 4 with subtypes A and B, making a total of 8 types. This classification was called Modified Fouaille classification after the name of their hospital. Here are the first set of references on classification of DORV. Second set of references are here.